everyone, my name is Beth Grenfell. Today I'd like to refresh some standard CPR procedures. In the event of an actual emergency, CPR is often the first response and is responsible for saving many lives. Now, although many of you have already had CPR training and some of you are actually certified in CPR, it is really important to practice regularly. Knowing signs that a person is in need of immediate help is crucial. Signs that someone's going to need the Heimlich maneuver would be hands around the throat. This would indicate that the person is choking. And however, for CPR, an unresponsive or unconscious victim would be your indicator. The Heimlich maneuver procedures for an infant are different than that of an adult. For an infant, first you need to assess whether or not the child is coughing. If they're coughing, you need to let them go ahead and do that because then they can get that object removed on their own. However, if they're not, you need to immediately take the child on your forearm upside down, get the child, remove these, several downward thrusts firm enough to dislodge that item from their throat. For a larger person, I'm going to use my son Logan. He's not exactly large, but anyway. You're going to position yourself behind the victim and interlock your hands between the navel and the chest. Give several inward and upward thrusts several times until the object pops out. For an unconscious victim, first thing you need to assess is whether or not this person is actually sleeping sound. Some people are pretty sound sleepers and might appear to be unconscious when they're not. For a child, an infant, that is, best thing to do is to stroke the bottom of their feet or their back. This will likely rouse them if they're only sleeping. For an adult or a larger child, tapping them and shouting would probably be the best way to do that. Now, if the person is unresponsive, then you need to have someone nearby dial 911 immediately and then begin CPR. However, if no one is around, you need to still go into CPR without calling 911 for at least 2 minutes. Logan, can you come here, please? This is my son, Logan. He's going to help me out here. Can you lay down, please? Lay down. All right. First thing you need to do is look and see whether or not they're breathing. You see this by the chest rising and falling. Also, put your head near their mouth to feel whether there's any air coming out. And tilt their head backward gently so that their tongue is removed from the airways. And then plug their nose. And you're going to give 2 rescue breaths followed by 30 chest compressions right in the middle of the breast between the nipples. Sometimes you might notice that there's a good loud crack because often the ribs will dislocate from the sternum, but this is appropriate. 30 compressions should be followed by 2 more rescue breaths. And continue to do so until a paramedic has arrived or someone can take over for you. It used to be that for every 5 chest compressions, you'd give only 1 rescue breath. However, according to the American Heart Association, in 1995, there's been some changes. Researchers have found that giving 30 chest compressions allows the rescuer to get into more of a rhythm as to better get the blood pumping through their body. However, with or without these changes, it's extremely important to practice these procedures regularly. A CPR qualified person who has practiced these procedures will be better able to help a person who is in need of their help, thus saving precious life. Thank you.